Hi, welcome to Needle Exchanges 101. This video is going to give you a brief overview about what needle exchanges are, the benefits that they can have on your community, and I'm going to provide you with a list of the typical resources and services that they would provide. So, to begin, needle exchanges, also called syringe exchange programs or harm reduction coalitions, are community-based programs whose primary goal is to reduce the medical, mental, and social risks of injected drug use, particularly the spread of blood-borne diseases and infections of people who inject drugs and other members of their community. They do this by providing access to free sterile needles and equipment and by providing places to safely dispose of used needles. People who inject drugs and share needles and other equipment have a higher risk of contracting a blood-borne disease. Many of the items that they use during injection can become infected, such as syringes, cooking containers, filters, tourniquets, and gauze. Did you know that dried blood with the hepatitis C virus is infectious for up to 6 weeks? Because even a very small amount of contaminated blood can spread infection, anyone who comes in contact with contaminated needles or equipment can also become infected, including first responders, firefighters, police officers, family and friends, and other community members. But people who inject can significantly reduce their risk of contracting and spreading diseases by using sterile needles and equipment every time they inject, and by safely disposing of their used needles and equipment in special receptacles called sharps containers. And this is where needle exchanges can benefit communities. Specifically for Utah, syringe exchanges have been operating and legal since March 25th, 2016. In the past 5 years, there has been an increase in the number of newly reported cases of blood-borne diseases such as HIV, hepatitis B, and hepatitis C. Specifically, the increase in hepatitis C is more than double the national average in Utah. The increase in cases correlates with increases in injection drug use, a result of the opioid epidemic seen in Utah as well as the rest of the country. Because of the lack of testing centers and rates of injection drug use, people in rural areas like Utah are particularly at an increased risk of spreading these diseases. The CDC has identified 3 counties in Utah that are at an increased risk of hepatitis C or HIV outbreaks: Beaver County, Carbon County, and Emery County. So, exchanges, if they want to operate inside Utah, have to register with the Utah Department of Health and send in quarterly reports about their activities. They also submit an annual report showing the effectiveness and sustainability of their program. If you want to join one or start one, you can click on the links in my Get Involved page or the link to the Utah Syringe Exchange Network on my resources page. There's a little video below this one that's going to outline the content that you can find on each of the pages of this website. Thanks for listening. Bye.